A 55 years old man present with episode of frank hematuria and on investigation is found to have T2 transitional cell carcinoma of the bladder. His staging investigation are negative for metastatic disease. That means there is no metastasis. What is the most appropriate management? That means a 55 years old man developed the bladder cancer, which is T2 transitional cell carcinoma, and there is no sign symptom of the metastasis. What may be the treatment option? Here the options are radical cystectomy, palliative radiotherapy, intravesical BCG, intravesical mitomycin C, and intravesical cisplatin. So now see the treatment option. Here the treatment option in case of the superficial lesion, TURBT in isolation is enough. That means transurethral resection of bladder tumor. So in case of superficial lesion, there is TURBT, that means the transurethral resection of the bladder tumor, and recurrence or higher grade, there is the intravesical chemotherapy. So intravesical chemotherapy is another option, and it may be given in the recurrence or higher grade. T2 disease are usually offered either surgery or radical radiotherapy. And here we can see the prognosis of the different stages. In case of T2, the prognosis is 60%, and the prognosis is higher in case of T1, which is 90%, and it is very less in case of the T4A, which is the metastasis. And in case of metastasis condition, it is very less, which is 10 to 25. And T2 lesions in young fit patient are best managed surgically. So surgically before giving any type of the chemo or radiotherapy. And palliative treatment and intravesical chemotherapy, they are not used for curative option. So palliative treatment and intravesical chemotherapy, they are not used in case where we want to give the curative treatment. Here we can see the different type of the tumor. Here the T2, it occurs the invasive in the inner half of the muscular propria, and T2B, it is invasive into the outer half of the muscular propria. That means when the muscular propria is involved in this condition, we should go for the radical cystectomy. So the answer is the radical cystectomy, because it is T2 transitional cell carcinoma and it is negative for the metastatic disease.